Hello, everyone, and welcome to today's session. My name is Crystal Fullerton, and I am the Farm Safety Coordinator with the PEI Federation of Agriculture. Together with a grant from the PEI Workers' Compensation Board, we are proud to present to you our Building a Sustainable Farmer webinar series. I'd like to introduce today's presenter, Laura MacDonald from PEI Smoking Cessation Program. Laura is a Provincial Tobacco Coordinator with the Chief Public Health Office. Today, she will discuss the challenges of stopping smoking and provide options to help make it a little less daunting. She will discuss the program in length and answer any questions you may have. Laura encourages questions throughout the presentation, so please feel free to ask. A few housekeeping issues to introduce before we begin. Please mute your videos before participating. We want to make sure that everyone has a high quality sound, so please do the mute button for everyone involved. We do have a chat and Q&A section, so please pay attention as there are boxes that you can press that will help you ask your questions anonymously. We encourage all dialogue because we want you to get as much as possible out of these webinars. Sometimes being anonymous will help questions pop up that others were too shy to ask. So please ask away, as this session is about learning about the importance of stopping smoking on the farm. Also, there will be a poll during this webinar. We ask that you participate. It only takes 1 minute and it's a very simple yes or no and multiple choice setup. It helps us and our funders to determine if we are moving in the correct direction with our webinars. If you have any additional questions after the event or suggestions for other speakers, you can contact us at farmsafety@peifa.ca. We will also be providing a recorded version of this webinar at a later date, so please check our website and YouTube channel. We would love for you to share this information. For those of you just joining us, welcome. And now I'm going to pass the webinar over to Laura MacDonald. Enjoy.
Thank you, Crystal, for the introduction. So I'll just continue on, and then if anyone joins while we're chatting, they can just pick up where we left off. So as Crystal introduced me, I'm Laura MacDonald. I am from Charlottetown, PEI, and I am the Provincial Tobacco Control Coordinator. I've been in this role for a year, as the role is actually brand new, the Chief Public Health Office, and I'll talk about that quickly when I chat about the Chief Public Health Office, but just a little bit about myself and why I chose this role in tobacco. You know, sometimes people think it's not that interesting working in tobacco industry. Previously, prior to this, I did work in mental health and addiction. So the majority of the population that I worked with were low income individuals, and over half of them actually were addicted to tobacco or some kind of other substance or illicit drug. So I just saw how prevalent it was in this population, but also I lost an aunt to lung cancer who was a smoker, and my father has been a smoker for 30 plus years, and he continues to smoke even today, as I am as the coordinator of the tobacco control program for the province. So that's a little bit why I decided to take on this role and leave mental health, because I really am passionate about making PEI tobacco free and supporting individuals to try to quit smoking and any other tobacco products. So that would be chewing, anything outside of the cultural norms of the tobacco use. So my partner is also a produce farmer in King Cora, so I thought this was really relevant because I understand the stressors that farming can bring into unpredictable times, especially this year or the last number of years, really. So, I know that bad habits or our vices such as smoking or alcohol or any type of vice really can be challenging and hard to quit, especially when you work in such a stressful environment like farming. So this is why I agreed to take part in today as well, because I think it's really important for this population of people. So today's topics, I really want to talk about the history of tobacco. So where it started, 1930s, before that, 1930s is when really advertisement of tobacco became featured. But it was prevalent in indigenous communities that used it actually as snuffing and as a cultural experience. And, there's more uses of tobacco. Today, I'm going to talk about the harmful uses and the history of the tobacco that was a harmful use. So the benefits of quitting, of course, there's numerous benefits. I'm going to talk about those. How you can prepare yourself to quit, because it is a process and it can actually take more than 30 attempts to quit smoking. And then, of course, the resources to help you quit smoking. So that would be the Smoking Cessation Program, which I coordinate, and the Smokers Helpline, and some other resources that are, would be beneficial for you. So I just want to talk about the Chief Public Health Office and where tobacco fits in the Chief Public Health Office, because tobacco, it obviously is a modifiable risk factor, and people can use it or can quit using tobacco, and it supports them in numerous areas of their life. Public health made it a mandate to implement a tobacco control program. So under the Chief Public Health Office, one of our main priorities is health promotion, and that is living tobacco free. So over the last 20 years, the Chief Public Health Office has made numerous strides for Islanders to live tobacco free, and that would be through the Smoke-Free PEI Act. And also recently we just implemented age 21, so you have to be 21 to buy tobacco products. And then our smoking cessation program. So, even though our program is for individuals that are currently using tobacco, so it's not preventative, it's after the fact, we do focus on tobacco control. So preventative measures for individuals to not pick up smoking, or if they are, what are the supports that you can help them with? So that is the mandate of the Chief Public Health Office, and that's where my role was developed in the last year, but it took over 20 years for the government to advocate for a coordinator role like this, because tobacco is everywhere, and we see it in our youth now with vaping. So it's really important to have a specific mandate for tobacco. So also in the Chief Public Health Office, we have 3 pillars of tobacco control. So that is the protection. So as I mentioned, Smoke-Free Places Act, our price and taxes, tobacco is highly taxed. And those taxes hopefully someday will be earmarked, so they actually go to our healthcare system rather to do anything else. And then Tobacco and ESD Sales Act. So tobacco and vapes, any of those products can actually only be sold in tobacco shops now and smoking shops. So these are actually changes that have been implemented in the last number of years, and more changes are coming within the next few years. Then we have prevention. So through prevention campaigns, I focus on youth, I focus on farmers, women who are pregnant, Indigenous communities, really anybody that is between a certain age group that use tobacco. So how can we prevent them from using? And then cessation, so the quit smoking program, so the smoking cessation program, which you'll hear me saying the quit program, the quit smoking, because smoking cessation isn't a known term for many people. So here we're getting into the history of tobacco. So as I said, tobacco has been around for many, many years, before BC, like it's been around for a long time. I'm really going to talk about when it became really publicized in the world, in our communities, and how it happened and why it became so popular. So as you see on this slide, between the 1930s and 1950s, the risks of tobacco were really unknown. So advertisements, CEOs, presidents of tobacco companies actually were able to advertise using doctors, using professional sports teams, really any public figure to sell the tobacco product. And they did a really great job of it because tobacco was very common and very prevalent among these times, really in any age group and any gender. As you see here, we have a sports team, and this was a news article. So what it says, the healthy nurse. So it actually said 21 out of 23 Giants world champions smoke Camels, which was a very known brand of cigarettes. And that's how they publicized it. They basically said, here's a sports team. Look at them, they're smoking, they can play sports, it helps with their nerves while they're playing. Why don't you pick up smoking? So at that time, again, because the health risks are really unknown, there's really no restrictions on advertising. Of course, now you rarely ever see advertising for cigarettes. Usually any type of advertising you're seeing is of someone that actually has had a health consequence of smoking, and it's never really good advertisement. Many of you saw that. So cigarettes were also depicted as safe, and they were not hazardous to our health. So in the First World War, I thought this was nice for the timing with Tomorrow Remembrance Day. Our boys want smoke. So our boys want smoke. So back in the First World War, the Canada Tobacco Fund actually collected money to send smokes to soldiers that were in the First World War. So this was quite common. There was numerous provinces that took part in different programs, but again, smoking was pushed. So you see pictures of the First World War, smoking a cigarette in a soldier's mouth was quite common. So I just wanted to show you that these were ads that really were prevalent at that time. Again, in the 1940s and 50s, we had a doctor and we have Ronald Reagan that are promoting smokes. We have Christmas time where he's sending cigarettes as a form of a gift, and then more doctors smoke Camels than any other cigarette. So at the time, doctors were huge in the smoking, and companies would actually send them cigarettes to try, and the doctors would agree to speak highly of that brand. So individuals would think, well, a doctor's smoking this brand, I should pick up smoking. So just seeing from the history of it, it was, of course, people wanted to pick up smoking, or it looked interesting, it looked intriguing, because when you saw these ads, it looked nice to smoke. It was the cool thing to do. So, that's a quick little brief history of tobacco and how it became what it became. In 1994, the presidents and CEOs of the 7 largest American tobacco companies actually testified before Congress in the United States that tobacco is not addictive. This is a video that just kind of goes back a number of years, almost 30 years, that these companies, which doesn't seem that long ago, actually think that tobacco is not addictive, or they know it was addictive and they refuse to make claims that it was. Really in the 1950s is when evidence became prevalent that lung cancer, COPD and breathing issues were common because of smoking, and that's when they started to do research. When they had the means to do it in the 1950s, and that's when things started coming out that actually tobacco was unsafe and it does cause health consequences. So I'm going to play a quick video here right now that talks about the tobacco and how it was not addictive. I don't believe you guys might be able to hear this. If you can hear it, if you can just let us know. Crystal and I tried it before and we couldn't hear it, but if you can't, I will basically just tell you what they're saying. So I don't know if you can hear this video, but all these CEOs, sorry?
I still can't hear it.
Okay, so I don't know if anyone else can hear it. Basically, all these CEOs and presidents sitting at the front of this room are all going through this panel and saying that nicotine is not addictive. So this is just in 1994. And again, as I said, in the 1950s is when evidence became known that nicotine was actually addictive and smoking caused numerous health complications. So the Surgeon General here is basically saying it's contradicting, what they're saying is contradicting with the evidence of what is out there that it is addictive. So that's just a quick understanding of how these companies misled individuals and communities to understand that tobacco really wasn't addictive. So just this there. So then this next video, it's on the screen, so you can read it. But basically what happened after that release, that all these presidents and CEOs said that nicotine wasn't addictive, they came back and the Surgeon General made them, the federal court made them publicly say that nicotine is addictive and it impacts your health, and it is not good for you. It was numerous years of back and forth and fighting because, of course, when these tobacco companies say that nicotine is addictive and there's health consequences, individuals are going to try to quit smoking and try to not buy them. Of course, we have seen a decrease in the world of smoking going down and nicotine use because of other products like vaping being picked up. However, smoking is still very common and is still the #1 cause of illness and death, particularly in PEI. So it's quite scary. So this video, you can read on the screen, just kind of shows you what they said. Okay, so that, again, just a little history of where we started, why we developed the smoking cessation program, and an actual strategy for tobacco control and PEI. We were one of the last provinces in Canada to implement a program to support Islanders to quit smoking. Up until the last year, there really wasn't many supports besides a healthcare professional or a program that provided individuals with funding to buy a nicotine replacement therapy, so patch or gum or prescription medication to help them quit smoking. Your doctor always advised you that you should quit smoking because it is addictive. It causes this health consequence. Eventually, it's going to take your life. But there was no supports out there that they could provide their patients to quit smoking. So it was kind of twofold. Like, yes, we understand that we have to quit smoking. We all understand the health consequences of smoking, but I need help. And there was nothing out there, really until this past year, until this program was implemented, where other provinces did provide the supports. So it's really good for PEI to be introducing this program, and exciting that I'm here today talking to you about it. So just a little bit about it, nicotine. As I said, the most of us know that it is physically and mentally addictive. So, it causes physical and mental symptoms. You're craving it all the time, like any addiction at all, food addiction, alcohol, nicotine, drugs, different substances. It causes that feeling that you need it. That smoke that you have because you're shaking, you're having those withdrawal symptoms because it's been a few hours since you had one. As soon as you smoke, you feel great, but your anxiety and your blood pressure is actually rising. It really isn't decreasing. So it really does take an effect on us physically and mentally. Of course, when we try to give up smoking, significant withdrawal symptoms are present. And if you ever try to give up smoking, or you have a family member, or somebody that has, that it isn't easy as cold turkey, not for everybody. And it's hard to do on your own and without support. So just a kind of little background, long-term exposure. So most smokers, 85% of them start at when they're 18. The smoking cessation program that PEI currently has and that offers individuals who are current smokers, the majority of 50% of the enrollments in the last year started when they were teens and are continuing to smoke. Our age range in our program actually is 18 to 85 years old. So it's a huge age range, and it's also years of nicotine exposure. So you can imagine the health consequences for that individual that's been smoking for 40-something plus years and possibly smoking 30 cigarettes a day, which sounds ridiculous, but we have numerous participants that do smoke 30 cigarettes a day. And so it's scary how tobacco has a hold on people, just like any other substance when you're addicted. So that's why it's really important to offer these programs. So again, I said the majority of smokers in our program are between 18 to 85, but the majority of smokers on PEI, I believe it's 18,000 smokers as of 2016. So we need some more recent data, but the majority of them are 25 to 44 years of age. So you're seeing a wide gap there in age for smokers. So earlier in the presentation, I said it can take 30 plus times for smokers to try to quit smoking. Based on how many years you smoked, it can take numerous times to quit. And if you are a smoker right now, or you're a previous smoker, you understand that. I have never smoked. I've tried it, but my father, I've been at him for 30 plus years to quit smoking, and he still hasn't. And I've seen, the times he's quit smoking, and I've seen how hard it was for him to try. He's trying right now, and I try to enroll him in the program, calling a nurse. But again, it's not easy, and especially when you're triggered, especially when you have withdrawal symptoms. So when we try to quit smoking, we have withdrawal symptoms that can be headache. People sometimes say they're hungry because typically if they're hungry before, they might picked up smoking or had a cigarette. People actually can gain weight because they are replacing that cigarette with food sometimes, because when you feel like you need to eat something or have the hand to mouth movement, you can actually be physically sick to your stomach. You have bad headaches, irritability, anger, which are very common ones. I know my dad, he is not a happy camper when he tries to quit smoking. So those are all really common symptoms, and those are the symptoms that actually typically lead people to pick up smoking again, or they're triggered by something. So on PEI, only 5 to 11% of people actually were successful in quitting, and that was without any supports. So that's a really low number, 5 to 11%. It's not great. So that's what we're trying to change with the smoking cessation program and PEI, is to have the support. So when people are triggered, or they're trying to quit and they're having withdrawal symptoms, we're actually replacing a cigarette with a treatment regimen in place to help them make that journey to be successful in quitting. So I'm not going to go on much about the addictive nature of smoking, because if you're a smoker, we all know that it is very addictive. So in PEI, tobacco is the leading preventable cause of illness and disability and death. It is a major modifiable risk factor for 5 diseases or contributors to illness. So that's cancer, heart disease, stroke, respiratory disease, and diabetes. Respiratory disease would be like COPD, which is quite prevalent. Majority of people try to quit smoking after they are diagnosed with one of these health conditions, which is really unfortunate, because at that point, sometimes it's too late. So we really want to support people not to pick up smoking, or help them quit smoking before these health conditions arise and become known, because at that point it's tough to even quit, because you have the stressors of new medications and a diagnosis of disease. So of course, tobacco in PEI has social and economic impacts. That's significant. It's significant for individuals, families, and our communities. The economic impacts, of course, are known. Individuals that are smokers end up in the hospital more so often than individuals who are non-smokers. They use the healthcare system more because they might have diabetes, COPD, which of course is then it comes to medication. So it has a huge economic impact. So the healthcare costs not for smokers and PEI have been millions of dollars over the last number of years that have gone out into the system for individuals that are smokers. The importance of a smoking cessation program, of course, is that we eventually, over time, these costs will diminish. And the small cost to pay for people's treatment to quit smoking is going to be significant to what the costs be to pay for people's treatment for cancer or diabetes over the long term. So it really does make a difference. Of course, families, smoking is tough on families. You're always worried about your partner or your father, or your friend who are smoking, because the health consequences and what it's going to do to them. But again, without the supports in place, why would they quit? So on PEI, as I said, it's 18,000 smokers. 50% of those smokers on PEI today will become ill or will die. So, as I have it here, 250 deaths per year over 9 years. Like, so it's scary when you see the numbers. I could throw lots of numbers at you, but at the end of the day, we all know what smoking does. It's just when it comes to the fact when you actually do get a diagnosis because you're a smoker, we want to beat that diagnosis, and we want to get you started on, get you successful in quitting before you're diagnosed with the disease. So smoking's scary. So, you know, we talked about the history briefly, and we talked about how it's very addictive to quit smoking. You know, people go on and on about those few things. It's moving on from the addiction. How do we live tobacco free? So, you know, I'm telling you about the health consequences of smoking, the withdrawal symptoms, but the supports in place to live tobacco free. And that's what's important, is to focus on the future and what's it look like for yourself if you want to live tobacco free. Of course, it's going to take a long time and it's going to be a journey to live tobacco free, but you know, the first step is making the plan to quit. So as I said, smoking is addictive. The tobacco, it's the nicotine in that tobacco that's addictive. It's not just in cigarettes, it's in chew, it's you know, in hookahs, it's in vapes, snuff, like it's numerous products that are in the market now. So it is a psychological addiction too. It's, you know, even though it's a physical, because it's that hand to mouth movement, you know, your body, you sweat, you have the feelings of anxiety, your heart's pounding, palpitations, stress, your hands are sweaty. All of those feelings are when you know that you need that drag. You know, you're in the office, or if you're a farmer, for example, and you don't know what this year is going to bring. Some farmers may still be digging. My farmer just finished digging. That was super stressful for him. There are numerous people on his farm that help him that are smokers. You know, Sean has his own vice, but they choose a vice. And Sean says, you know, trying to tell these guys to quit smoking, that's just not going to happen. This is what he says to me. And it may not be because of the situation that they're in, but there's still a resource out there. And even if you try to quit smoking once, if you don't give it up and you just diminish the amount of smokes you smoke a day, or you're chewing less or smoking cigars less, that's okay. It's, you know, that's a milestone. That's one success. So it's just making those small steps towards smoking less or completely quitting. And eventually, maybe you'll catch on, hopefully. And that's what we strive for. We smoke for numerous unpleasant reasons. As I said, we have anxiety. The roundabouts on PEI might stress you out. I know my father, anytime he drives his vehicle and goes around a roundabout, he needs to smoke after because he's stressed. Digging season, you know, crops, harvest, if you have, you know, horses, cows, whatever that is, whatever background you come from, it can be stressful. And anytime you are a smoker, that stress induces you to smoke more. So you might be a 2 smoke a day person or 5 smoke a day, but then something triggers you as a, you know, an event where money is on the line, or your crop, or something's on the line, that's going to trigger you to smoke more within a day or within a time frame. And so, you know, you really have to understand those triggers and what makes you smoke, and the triggers that make you smoke. Again, that could be a social setting. You could be out with friends, you could be at someone's house and other people around you are smoking. Well, if that's a trigger for you and you are trying to quit smoking and live tobacco free, it'd be best to avoid those situations for a period of time until you really feel like, okay, like I think I can do this and be around people that are smoking and not want to smoke. Again, it does take time, but there are resources out there to help you. Quitting smoking has numerous benefits. Of course, we're saving money on cigarettes. It's over $20 a day for a pack of cigarettes for 20 to 25. If you smoke a pack a day or more than 1 pack a week, that's a lot of money. And then you're probably also getting coffee in there too, right? So you're really adding up the money. So if you quit smoking, there's a free program to provide you treatment. You're saving all that money. So it really benefits you for your pocket. You won't have to stand out in the cold if you have to smoke outside, if you're partner won't let you smoke in the house. You can't smoke anywhere in public anymore, really. So you have to go find a location and smoke outside. And if it's a really cold winter day, that's not fun. Your sense of smell, actually, your taste will also improve. Your breathing will improve within the first 30 minutes of giving up a cigarette. There's a number of health improvements. Your blood pressure will drop. Plaque around your arteries won't be, it will be less, I guess is what I'm trying to say. So there's a number of health consequences, social consequences. You're going to be in an environment, people, where you're no longer smoking. You won't have the smell of smoke. And smoke won't control your life. Having that feeling where you need that release and you need that cigarette, that won't be there anymore. You might replace it with something else, but at least try to replace it with a good habit rather than something that eventually will take your life or will lead to something that's going to take your life. At the end of the day, that's what it's going to do. So if you are ready to quit, first thing to do is ask for help. So that could be telling your family, your friends, you're ready to quit. That's the first step, because typically in your social environment, you might have friends that smoke. So it's really important to let them know that you are trying to quit smoking. Also talk to your healthcare provider. That's how people find out about the smoking cessation program, the quit smoking program. But also there's other resources out there, and they can provide you really good advice as to why it's important to quit smoking and any other risk factors. So, if you are diabetic, well, what's the best approach for you to quit smoking? And then it's also healthcare providers can also address the other effects of quitting smoking. So eating more, which sometimes counts with quitting smoking. It's talking about the nutrition element of that and being smart. So we don't want you to gain 20 pounds because that's not good for your health. We want you to quit smoking and do it the right way. So healthcare providers, a holistic approach, so numerous healthcare providers can be really helpful. Setting a quit date. So in the smoking cessation program, you do have to quit within the next month. You have to agree to quit within the next month to be enrolled. Setting that quit date holds you accountable. So I'm not ready this weekend because I know I have to be, at a party, or I'm going to be digging, or I'm going to be spraying or putting manure down. And typically when I do that, I like to have a cigarette, or I like to have a cigar, or I like to chew. Well, so maybe it's a month from now, or maybe it's 2 weeks from now, but holding that date accountable, using up all the smokes in your pack, giving them away one at a time, and not allowing yourself to go buy anymore. That's how you prepare. You can also, make sure that your clothes are clean, so you're not smelling that tobacco, and it triggers you to want to pick it up again. It's just preparing your lifestyle to make that change. Avoiding those triggers. So as I said, there's numerous triggers that can cause you to smoke. Maybe having coffee in the morning because you like to have a cigarette as soon as you wake up with a cup of coffee. Well, maybe have a cup of tea, or maybe try to change it. I know coffee is great, but sometimes it can lead to smoking. So it's understanding that trigger and numerous other triggers. And then coping with withdrawal symptoms. So anytime you are taking that nicotine out of your system, it can, 20 minutes that withdrawal symptom can start because you're not replacing it with nicotine. That's what a patch or prescription medication or gum can do, is release continuous nicotine into your system in a safer manner than a cigarette because it's less chemicals, or gum, nicotine gum, like Nicorette. It takes that urge away. Maybe it's a sucker. You're doing the hand and mouth movement. So it's all these pieces that you need to understand that can help you with withdrawals, because there are numerous withdrawals. But again, talking to a healthcare provider about these withdrawals is really important. Of course, talking to a healthcare provider also helps when you're on different medications, maybe for COPD, for your heart, diabetes, because there always are symptom or interactions between medications and any type of quit smoking medication that you might take on. So it's really important to always include a healthcare professional. If you don't have one, walk-in clinics or one of our primary care centers, which I'll talk about, are a great resource as well. Enrolling in the smoking cessation program. If you are ready to quit, don't go out and buy your own products. If you don't have the means to do that, if you want to quit today and you know that you need to start today, then you might not get an appointment right away, so you might have to go buy a patch for yourself. But that's okay because you're taking the cigarette pack where that money would have went and putting it towards a patch. So patches are that constant nicotine in your system being released into your system. Or you can enroll in the smoking cessation program. So again, I'm going to talk about this, but that's a program to support you and gives you a minimum of 12 weeks of free nicotine replacement therapies and prescription medication. So again, you're giving up the cigarette, but you're replacing that nicotine withdrawal with other nicotine that's safer. So you're not just going cold turkey, like the days that you used to do that. And some people still do it and are really successful, which is great, but it's not easy. So again, relapse, it's very common. If you're not successful the first time, which, most times does happen, you just rebound. Just learn what caused that trigger. Where were you? What was the reasoning? Was there a death in the family? Was it COVID? What was it that caused that trigger? And try to move past it and try to learn from that experience to take on trying to quit again. Maybe it was being in a social setting where people around you were smoking. Well, again, that's what I said, try to avoid those settings when you're having those withdrawal symptoms, because typically when you're having withdrawal symptoms, that's when you're picking up the cigarette again, or a cigar, or whatever the tobacco means is. Any questions at all? Okay. So cessation. So again, here's that word, cessation. Basically, it's quit smoking. It's a quit smoking word that we use. It makes sense. So not just makes sense to quit smoking, but also cost effective. Quitting smoking, you're saving money on your own healthcare costs, especially if you don't have private insurance. You're not putting money out to pay for smokes. And it's an evidence-based intervention. So really just what that means is cessation, so quit smoking research focuses on nicotine replacement therapies and counseling. So talking to somebody, that can be through Smokers Helpline, your doctor, a nurse, any healthcare provider, a physiotherapist, your friend, talking to them about quitting and their withdrawal symptoms, or talking to someone like a peer support person who's smoked before and they get it, and using a nicotine replacement therapy in lieu of smoking really increase your chances by 30% of quitting. So that cold turkey means that people used to do maybe not work as great as actually taking up chewing gum or patch. So of course, for the individual, if you quit today, you're lowering your risk of cancer, COPD, respiratory symptoms. You're going to start breathing better. You're going to start feeling better. Maybe you feel like walking and it's not going to be as hard for you to breathe. So there's numerous health successes if you quit smoking. Anytime you go to your doctors, they usually have a poster on their wall that says within 30 minutes, within 5 minutes. It's that layout that, within 5 years, your stroke decreases by half. So a risk of stroke or heart attack decreases by half of 5 years of quitting smoking. You're basically just taking that risk away for yourself, especially if you already have a risk of heart attack or stroke because it's in your family or whatever that healthcare or health consequence is. So just think about all those things when you really want to quit. It's really good for your health. Again, if you smoke a pack a day, which seems unrealistic, but it's very common for people to smoke more than 20 cigarettes a day, saves now, this number was, a few months ago, $43.80. So over $4,000, probably closer to $5,000 in a year. So you can just imagine what you could do with that money. And then, of course, anytime you quit smoking and you give up cigarettes, it's saving our healthcare system on costs. Even secondhand smoke, people with secondhand smoke are just as likely to have a heart attack, stroke, COPD, develop lung cancer because they're exposed to that. And that's not just within a home. It actually could be, out in a field somewhere or in a warehouse, in a car. Really, anytime you're outside standing around somebody who's smoking, you're inhaling that smoke. So there's always a risk there. And if you're already predisposed because you do have heart disease, you really need to be careful. So it's just quitting smoking saves a lot of money for everybody and saves us on healthcare costs, and it's just better overall for your health. So getting into the PEI Smoking Cessation Program. So this is the quit smoking program. So this is a program that we're going to support you when you are ready to quit smoking. Really what this program is, started off as a pilot project last December in the Chief Public Health Office. So we implemented it last December 2019. And what we offer is, or provide, is we're covering 100% of nicotine replacement therapies or quit smoking medications. So nicotine replacement therapies, that would be in the form of patch, gum, lozenges, so just like a candy or an actual inhaler, and then smoking cessation medication, it's Zyban or Champix. So of course, again, speaking to your healthcare provider about these quit smoking medications, because they all offer different means. And some of them are successful more than others. For example, if you're a smoker that smokes often and just want to pick up the gum, not ideal, because it only gives you when you're having the withdrawal symptoms and you're having cravings, chewing the piece of gum is great, but you're not getting the constant release of nicotine that you're always getting. So it's really important sometimes that you use dual patch gum or patch and inhaler, or Champix and gum. So Champix and Zyban, they actually give you, it's not nicotine, but they're taking away those feelings of, they're basically releasing endorphins in your system all the time. So you're always feeling good and you're not getting the cravings. Of course, like any other medication, there's numerous side effects to them, like some crazy dreams sometimes. So it's really important that you do talk to your healthcare provider. But when you're ready to quit smoking, it's just very important to know that there is a program that covers 100% of the cost for a minimum of 3 months to a maximum of 5 months. So to quit, that's really how long it takes to be on treatment to get rid of those symptoms based on how often you smoke, but also counseling. So as I said, speaking to a healthcare provider and enrolling in a program, maybe Smokers Helpline, or you're going to peer support with another individual that used to smoke, or talking to a friend that's doing it. So, you always have that support, because it is difficult. And when you have those symptoms of withdrawals or you're triggered, you need to make sure you're not going back to quitting smoking. You're doing something else to replace it. The deal with this program, you do have to book an appointment to see a nurse at one of the primary healthcare centers across the island. And you're only eligible once per year. So you can only receive a single continuous course. So it has to be 12 weeks to 18 weeks at a time. You can't decide, I'm going to quit this month, pick up smoking, and quit in 2 months, and the program pays for it. Unfortunately, the program only pays for when you're ready to quit now or within the next month. We'll pay for 12 weeks all at that one time, because you're more successful to quit then than picking up and not. It's like anything. If you ever try to cut out sugar, it's very difficult when you go 2 days with no sugar. You eat sugar third day, you're probably not going to last longer than that. And I can talk from experience. So that's the deal with the program. Covers 100%, gives you nicotine replacement therapies or medications. If you have the means to buy gum or inhaler or lozenges to work with your patches or a Champix or Zyban, one of the prescription medications, that would be ideal, because dual use of both products actually increase your chances of quitting successfully. Not everyone has a financial means to support themselves in another product, but there's resources that can send you products, the free products. So it's really, really good to understand what's out there. So 2 components of this program, they provide counseling. You're getting counseling by a nurse who's actually trained to support you in quit smoking. And then you're patching, or you're taking a medication. So you're completely giving up cigarettes and you're replacing it with another form of nicotine, or something that basically just takes away all those feelings of addiction, which sounds lovely. So the program's for any PEI resident. So it is a minimum of 12 weeks and a maximum of 18 weeks. That's based on how much you smoke per day, or chew, or cigar. It is only for people that use tobacco products. People do ask about vaping. If you vape and you smoke, or you vape nicotine, because there's numerous different kind of vapes, we will support you in this program. People also ask, or it's common to give up smoking and pick up vaping. There is some evidence behind this. However, as we all know, vaping can be quite dangerous. And if you're not completely giving up vaping and you're just replacing cigarettes with a vape, well, you're really not changing any of your behaviors, and your health probably isn't going to improve because you're still replacing nicotine with other thousands of chemicals in your body. So just to kind of talk about those pieces. Again, if you're not sure what to use, that's why it's really important to speak to any healthcare provider. It doesn't have to be a nurse; it can be your doctor or somebody else. And to access this program, it's, as I said, it's through primary care networks. So if I want to quit smoking today and I'm not sure where to go, you can either call me and I list in my contact information, or you can go to your doctor, you can go to a pharmacist, you can go to any healthcare provider, and they all pretty much know about this program, or they should know about this program. We advertise this program all over Facebook, social media. It's been in the news, it's been in papers, radio. So every healthcare provider should be aware of what's available. They will refer you to a primary care network or give you a number to call within your community. You make a call, you tell the nurse at a primary care center that you want to quit smoking, and then they'll book you an appointment. Prior to COVID, appointments were in person. Right now, the majority of them are via telephone, but you receive an appointment within 1 or 2 days. So if you're ready to quit tomorrow and you call today, you let them know that you're ready, they're going to get you in right away. So the program's great. It has numerous advantages. You know, it all starts making that first step and making that phone call, and then it goes from there. Once you make that phone call to the primary care nurse, you have your appointment. They send your information to whatever pharmacy you go to, and then you just go pick up your products. For just like any other medication you'd be on, you're going every 2 to 4 weeks to pick up product. So that's how it works. During that session with the primary care nurse, they are going to talk to you about your tobacco use history. They are going to talk to you about any triggers that may trigger you. They're also going to address any healthcare concerns you might have. So if you are diabetic or if you're COPD, there are programs that they can enroll you in to support you in trying to quit, but also manage your health. So they're really that holistic community-based network that connects you to RNs, nurse practitioners, there's physicians, and then they connect you to any other resource out there. So maybe it's mental health resources, or maybe it's respiratory resources. It's really any resource you need. It's that first point of contact. So it's with a primary care nurse. And essentially these health networks, there's 13 of them across the island. They're for anyone, any islander. You don't have to have a physician, a family doctor to access them. You can just call and then make an appointment. So there's really no barrier in getting an appointment there at all. So it's really excellent because we know there's numerous islanders that don't have family doctors. So that's why the nurse practitioners or RNs are great. This program is also offered at the Cancer Treatment Center because individuals that are going through cancer treatment therapy, their therapy is actually more successful when they quit smoking. So we have this program there as well. So the nurse at the primary care center will educate you on your triggers, will tell you about the products, so all the nicotine replacement products, and what one might be best for you. And they're going to counsel you. They're going to follow up with you 2 weeks to 4 weeks to make sure that you're doing okay. Maybe the product isn't working for you. So the patch is causing a rash, or you're feeling sick, you're having really weird dreams from a medication. They can help you change that product or go down in treatment. They can provide a number of resources. So again, talking to the healthcare provider is really key in quitting smoking in this program. So that's why we chose primary care centers. And this slide right now just shows you a visual of where they're all located. So all the red marks show you the communities of where a healthcare network is located. And then there's actually outreach services within different communities across the island as well. So you might not be near, say, Tignish, for example. You might be somewhere more central, but you can't get to an appointment. Well, they actually might offer it somewhere else, like at a pharmacy clinic or a Murphy's pharmacy, somewhere like that. They do outreach services. So it's really excellent in being able to access these services because there's always 30 minutes away or less. And the best thing too is now you can do it over the phone. So you really don't have to go in, expose yourself to potential COVID, and do it from the comfort of your own home and talk to a nurse in confidence and develop that relationship, which is really great. If you want to go into to see the nurse, she will book you in to see her or he, but just know that the means of accessing this program, it's really fabulous. If you don't have a phone, a cell phone, hopefully your neighbor, or you can go to a pharmacy, or you can go to a store near you and make that call and plan an appointment with the nurse. So there really isn't barriers in terms of getting an appointment to quit smoking. So during the intake, as I said, the nurse is going to talk to you about your tobacco use history. They're asking you 4 questions, really important questions. How important is it to quit smoking? So you really have to be ready to quit smoking to make that change. If you're not ready, you're probably most likely not going to be successful. So you have to be ready yourself. And maybe it's just in a month time, it's preparing yourself to quit. That's okay, but you have to be ready to quit smoking to make that change. You have to be confident. You know, if you're kind of like, oh, I don't know if I can do it today, well, give it a few weeks. Read about it, read about the health consequences, educate yourself on the importance of quitting smoking and what you can do to support your health to actually quit. So that's really important. And then can you quit within the next month? And setting a quit date. Again, the importance of the quit date is preparing yourself. So getting rid of those smokes, cleaning the house, getting rid of the smell of tobacco, telling your friends, avoiding scenarios that bring on smoking, and then understanding the products that are best for you, because you do need to replace that nicotine with something else. Otherwise, your success, again, is probably not going to be very successful. These are just our resources here. We have our brochures are located across pharmacies. We have posters with numerous resources and information on them. So that's just for individuals' use. To receive our brochure, you can get them at your local pharmacy, or you can receive them at a doctor's office or a primary care center. Pharmacies typically know about them. If you have questions about this program, they all know about the program. They cannot offer that appointment, but what they do is offer you the medication or the treatment. And any side effects you may have, your pharmacist is a good place to start and ask questions, but also the primary care nurse, because they're going to be there to support you the whole way. And then, of course, the available resources. Again, as I said, it's really important to educate yourself when you prepare to quit smoking, and even while you're in the process of quitting smoking, or after, if you're having triggers, you're having withdrawal symptoms, where can you go to find out really great resources to help you? So maybe it is friends or family, a healthcare provider, but Smokers Helpline, we've all heard of it, I'm sure. They really do have awesome resources. They provide support via online text messaging, email, online chat, like so instant message. You can call them if you prefer to call. They actually provide you with free nicotine replacement therapies. So if you sign up to join them, they'll send you monthly emails with resources on how to quit. They'll connect you with an actual person, a real person who's a quit coach, and that's going to be your quit coach. So in addition to that nurse that you're going to meet, that's going to enroll you in this program, you can sign up to have a quit coach to support you along your journey of quitting smoking. It's confidential, so you don't have to worry about people finding out if you're that you're getting help. But also too, if you're unsure that you want to quit, when you enroll in the Smokers Helpline, they'll send you in the mail a patch and gum and lozenges and a bunch of resources really to prepare you to quit smoking. So that's when you can try the patch, and maybe you like it, maybe you don't, and you can try the gum. So it's free. Why not try it? It's a great resource. And, if you're not a smoker yourself, sharing that with your friends or family or anyone, a colleague that you work with, or people on the farm, wherever that may be, any of the boards you're on, letting them know that they can go to the Smokers Helpline and get all these resources to help them prepare to quit smoking. And then there's numerous websites. We have Health Canada, we have the World Health Organization, we have the Canadian Cancer Society, the Lung Association. They offer support, they offer education. and resources, again, to make the right choice to quit smoking, and give you everything you need to know to prepare yourself during the process and then after the process of what to expect. So that's really the resources and what's out there to help you. And of course, me. I can direct you to anywhere you need to go, and any questions that you may have.
So I'm going to jump right in here, Laura, and give you a few moments to have a drink and parch your throat, because I'm sure you're probably good and dry.
Dry.
I've put a poll up for our attendees to fill in. It only takes a very quick minute. If you could do that for me, that would be much appreciated. It does help us with our webinars in the future, just to make sure that we're on track of providing content that people are going to be interested in. I'm going to take advantage of you here for a second, Laura, and ask a couple of questions, if you don't mind.
Sure.
So you said you take about 900 people a year. Is that, you have a cap, or?
So we did have, it was a pilot program as of last December. We started off late because, of course, that's normal, right? So they basically, to start off, the government said 900 participants is what we're expected to enroll in this program. And we're almost at a year in this program as of next month, and we're above 1,500 people. So wow. Yeah, and they're not cutting us off. Like, they're not going to cut people off and say, no, unfortunately, you can't enroll because we're at our enrollment cap. We want people to enroll in this program, so we're doing everything we can to get people to enroll in the program.
Oh, that's wonderful to hear. That's wonderful to hear. You had also mentioned that there's the option to have a counselor to be able to talk to. How often do participants have a chance to talk to that person? Is it like a scheduled one, or can they call it whenever they feel the need?
Sure. So, so the counselor is the nurse. So that's the their support is that primary care nurse, and really the primary care is just a nurse that provides, touches on pretty much everything, and for obviously people that don't have a healthcare provider. So that would be the counselor. So that would be the quit smoking counselor. Not aside from the smokers helpline. So the nurse, you can call that nurse whenever you need them. You can book a follow-up appointment. You can book an appointment before you want to quit smoking to get all the information, to have it and prepare yourself. So it's really just like any other healthcare provider, reaching out, calling them, asking them to call you. I know nurses are quite often in conversation with their patients after the first appointment, and they always follow up after the first appointment to make sure you're doing okay. So you're never really alone.
Oh, okay, good. And one other question for you before I let other people jump in. So what do you do with individuals who are heavy smokers and say they suffer some sort of health crisis and have to go into the hospital for an extended period of time? Is there some sort of treatment that the doctors, the emergency people, that they can help them out with, or are they instantly on the cold turkey?
That's a really good question, actually. So that happens a lot. People go in the hospital and they're current smokers, and the hospital policy is that you're not allowed to smoke on their grounds. I see people smoking on the ground, so I don't think it's really enforced, but what they do is actually provide you a patch. So if you're admitted into hospital, they patch you right away. Do you have the option? Yes, absolutely, you have the option, but most people do take that patch. And then they will refer you to a respiratory therapist oftentimes if you are admitted, if you are a smoker. So they're making that connection. And then when the person is no longer admitted and they're released, then they connect them to this program, the Smoking Cessation Program. The majority of participants that we hear from do say, I quit while I was in hospital and I want to continue being smoke-free. So then they're enrolled in the program right away, and then they have access right away to whatever medication or prescription or nicotine replacement therapy they choose.
Good to hear. Good to hear. Does anyone have any questions as we're wrapping up our webinar here? We're getting near to the end of it, but please, if you have some questions, right now is the time to ask them. This lady can help you out. It's seeming very quiet. Well, I'm going to take advantage and ask one more question of you. So is this program unique to just PEI, or are there similar type ones throughout Canada?
So PEI is really the only province besides BC that provide 100% coverage for nicotine replacement therapy and prescription medications. So us in BC, we actually modeled our program off of BC's. Are really the only provinces that provide 100% coverage. Lots of other provinces like Nova Scotia, for example, they provide this program too, but through the healthcare settings is where it looks different in every province. BC and Nova Scotia provide it through their pharmacies, so the pharmacy is actually the first point of contact. So when you go see your pharmacist, because you do see your pharmacist typically most often if you are in a medication and you're a smoker, then they will enroll you in a program similar to something like this, and you'll have an option to access nicotine replacement therapy. The only downside is not every province provides 100% coverage, so you would be responsible to pay out of pocket, which it's not, people really don't like paying out of pocket when they want to quit smoking, especially when they know there's other programs out there that pay for 100% coverage. So yes, there are other programs in different provinces, just not identical to ours. And we are always looking at other models too, I should say. So, pharmacy, we are always in communication with pharmacy, the Pharmacy Association, to discuss what other models look like and how we can expand, because we are eventually probably going to expand our program, but at this time we're waiting for our program evaluation. So any participant that took part in this program is actually receiving phone calls right now. It started a month ago. 6.5 months after they've quit, they're receiving calls to hear about the experience and if they were successful.
Good. So is there any other questions from anyone?
Smoking isn't a hot topic, so.
It's an important one, but it's hard to
push. Yeah.
There's not a lot of bling and bells and whistles with it, I think. Oh my goodness.
Yeah, that's why I had pictures.
Oh my goodness. Well, listen, Laura, I want to say thank you very much for you coming and taking the time to come speak to us today. A lot of information. I took a lot of notes, and hopefully everyone that was here today and is part of the videos when we start posting them back online will see the value in this. And once again, thank you, Laura. Thank you to all the participants who showed up. Really want to suggest checking out our other webinars. Check out our website at PEI FA, and it's under the Building a Sustainable Farmer webinar series. And we'd love to see you come to other events. Have yourselves a great day. Take care and stop smoking.
Thanks so much, everybody.
All right. Thank you, Laura.
Bye, Crystal.
Bye-bye.